Are you seeing patients with persistent anxiety, brain fog, or fatigue, and not getting the full picture from traditional testing? The OAP Organic Acids Profile could be the missing piece. Hi, I'm Jenn Evon from the Diagnostic Solutions Laboratory clinical team. The OAP Organic Acids Profile gives you valuable insights into key neurotransmitters like serotonin, dopamine, norepinephrine, and epinephrine, and how they're functioning in the body. The OAP Organic Acids test looks at neurotransmitter pathways and mitochondrial function by measuring urinary metabolites, and it helps you uncover nutrient precursor or cofactor deficiencies or signs of increased neurotransmitter turnover from stress or inflammation. The OAP is an easy at-home test that identifies functional imbalances for patients with persistent mood symptoms. So now let's talk about some of the key markers on the OAP to consider when interpreting results for patients with anxiety, depression, or other mood-related symptoms. One of the key markers on the OAP for evaluating serotonin activity is 5-HIAA, the primary urinary metabolite of serotonin turnover. Low levels of 5-HIAA may suggest reduced serotonin production, potentially due to low tryptophan availability, poor absorption, or insufficient levels of cofactors like vitamin B6. Elevated 5-HIAA can reflect increased serotonin turnover or breakdown, which is sometimes seen in chronic stress or in patients with significant gut imbalances, as more than 90% of serotonin is produced in the GI tract. 5-HIAA is particularly useful in patients dealing with depression, irritability, sleep disturbances, or emotional instability, as it can pinpoint whether the underlying issue is one of production, depletion, or excess breakdown. To assess dopamine metabolism, the OAP includes vanillylmandelic acid, or HVA. Low levels of HVA may indicate reduced dopamine synthesis, which could be tied to mitochondrial dysfunction or low nutrient cofactors like tyrosine, B6, or iron. Elevated HVA may reflect increased dopamine turnover, which can occur in states of excitatory overload or oxidative stress. Evaluating HVA in context allows you to understand whether your patient's symptoms are related to dopamine underproduction, high demand, or blocked metabolism. Vanillylmandelic acid, or VMA, is another important marker, and it reflects the breakdown of norepinephrine and epinephrine, two key catecholamine neurotransmitters in the stress response. Because dopamine metabolizes to norepinephrine, the OAP includes the HVA to VMA ratio to reflect the balance of these neurotransmitters. And this balance, of course, depends on adequate nutrient cofactors, such as B vitamins, copper, and vitamin C. The OAP Organic Acids test includes markers like pyridoxic acid and xanthurenic acid, which help assess vitamin B6 status. B6 is crucial for the synthesis of serotonin, dopamine, and other key neurotransmitters, making it an important checkpoint for assessing mood-related symptoms. And vitamin B12 and folate are also integral nutrients to many enzymatic processes involved in neurotransmitter production and energy metabolism. The OAP offers an indirect assessment of your patient's B vitamin status, which is essential when unraveling mental health symptoms. When patients are struggling with persistent mood, focus, or energy concerns, the OAP helps you look beneath the surface. This organic acids test reveals biochemical and metabolic drivers behind mood-related symptoms, so you can create impactful protocols that improve your patient's depression, anxiety, and mood. Learn more about interpreting the OAP Organic Acids Profile by downloading the OAP Interpretive Guide linked in the description box of this video. Like, comment, and subscribe for more.